Columbia Morning at KFRU. We've had an opportunity to talk with Dr. Mark Wakefield for a while and talk about transplants often. And earlier this spring we did. And we've also had updates from him as he is the Associate Chief Medical Officer, University of Missouri Healthcare, and also a urologist and chief of the Department of the Surgery Division of Urology at the School of Medicine. Dr. Wakefield, good morning. How are things with you, sir?
I'm doing great, thank you.
I wanted to ask you about your commentary. I believe this was in the Tribune, and the commentary was given the headline, "A New Normal is Drawing Closer." Summarize some of the points that you made in that commentary about what we can expect now as we continue to deal with COVID-19 and beyond.
Right. So I'm looking for better verbiage than a new normal, because it's abnormal. It's a new abnormal. And I think we've done many precautions to protect patients and staff, but we can't continue to neglect healthcare and economic principles to be 100% safe. And so we have changed our kind of daily operating procedures in the hospital, in surgery, in clinics to facilitate as safe as possible seeing patients and doing surgeries, and in the healthcare complex, we're starting to think about how we're going to safely do research, as an example, which has been completely put on hold at the medical center to a large degree for months now.
So if I'm a patient, what should I expect, and how can I be a good patient compared to right now to what it would have been like a year ago? What should I expect as difference?
Well, things are likely to continue to change, so I think all of us benefit from being adaptive and flexible, because something that we thought was true 2 weeks ago, we've learned something new. Either it wasn't effective, or new research has shown that there's better ways of doing things. So having a flexible mindset for all of us, I think, is very, very important. Sometimes, we take comfort in rigid. Surgeons are a perfect example of this. We like to do things the same way, so we have control, and we have to be a little bit more flexible. Right now, we've had to adapt to limitations on visitors. So I think we've done a really good job in the clinics of maintaining low congestion in the waiting rooms, despite increasing our clinical volumes. We were close to 85% of our pre-COVID clinic volume last week, and continue increasing that volume each week. And we've done that safely by keeping visitors to a minimum, which can be really frustrating to a patient and their family, especially if there's important things being discussed. So we've been using a lot of cell phones and group chats to kind of figure out what the best next step on treatment might be.
What are the challenges for a hospital and a clinic to make the decision to move forward with some of the other procedures that have been put on hold? I'm not going to say they are elective, although maybe some are elective, but others are important. It's just that they dropped in the importance once it became a concern about what was happening with the COVID-19 virus. But how does a facility, how do hospitals and physicians decide to take another step forward?
Well, I think for us, critical steps were, one, we had enough PPE. So initially we decided to eliminate some in-between acuity surgical procedures. They weren't emergencies, but they shouldn't wait very long. And we deferred some of those while we made sure we had enough PPE for either a surge of patients with COVID, or if our supply chain was not restocking. I mean, we normally would restock things like gloves and gowns and masks once a week, and it was just a steady supply once a week, and then all of a sudden we couldn't get any masks or gowns or gloves. And so we were utilizing at the same rate, so we had to decrease the rate. So once we were secure in our supply chain, we felt like that was the first thing we could do to allow increasing volumes. Then the next thing is you got to really protect your staff. because they're exposed, and even though the prevalence of the disease in our community is very low, if you start seeing more and more patients, eventually there's some risk of exposure. So we did things like deciding that we were going to test all patients who were going to have scheduled surgeries for COVID beforehand. And then maintain social distancing so that we didn't contribute to, the population spread. So I think it was that when we felt we could safely do these, we utilized them.
I do appreciate so much the visits that you have given us, and especially this one today. Thank you so much. Anything else on your mind that we haven't talked about so far?
Well, we always enjoy our conversations as well. I mean, I think I was put into a situation where I like to advocate for knowledge about kidney transplant and transplant and donation, and then I've had to adapt to learning more about COVID and coronavirus. And what I've been amazed by is that people have really come together as a team, and the community has adapted. When we first started talking, we talked about bending the curve. And we've done that. We're still seeing community-acquired cases, but we knew we would, and we didn't overwhelm our system. And one of the things that I think is super important about that is, as a learning institution, we are so much better prepared for sick patients now than we were 2 months ago. And if nothing else, bending the curve bought us time to learn all these things, how to safely get patients into the clinic, how to take care of someone critically ill with COVID. We learn from ourselves, and we learn from other institutions in New York and Seattle. And so it's a pretty amazing accomplishment for the institutions and the community. And now we just have to be prepared to adapt to future unknowns.
Well, I'm so glad you said those things, because that gives us a sense of understanding of how it was a good preparation, and how I think those we leaders who made decisions did things right in the early stages of this here locally. Dr. Wakefield, thank you so much. Best of luck to you, and we'll talk again down the road. Appreciate it.
I look forward to it.
Thank you. Dr. Mark Wakefield, Associate Chief Medical Officer at the University of Missouri Healthcare, has been our guest. It's Columbia Morning at KFRU.